Okay, at this time, we will start the health meeting at 8:31. We will move to, I'll call this meeting to order. Roll call. Um, Jeff and Virginia are not here. Next, we'll move to the approval of the agenda. Do I have a motion? Milty?
I so move to approve the agenda as written.
Kathy, a second. All in favor say aye.
Aye.
Opposed? Then we'll move to the approval of the November minutes.
I so move.
Julie, a first. Do I have a second? Milty, a second. All in favor say aye.
Aye.
Opposed? Then citizen input. Is there any citizen input? Nothing? Okay. Then we'll move to COVID update. Cindy, I'll let you take it from here.
All right. So our last count was done on Friday, which you should have received, but we were at 1,909 positive cases. Of those positive cases, we had 124 active at that time. Our death count in the last month has gone up considerably if you've been following that. So we are at 25 deaths currently. The majority of those deaths have taken place in either CBRFs, nursing homes, or some kind of assisted living facility. We're averaging somewhere between 15 and 25 new cases a day. We have days that are less, we have days that are more. I think sometimes that is dependent on right now shipping of test results to the labs. So, on top of everything else going on, we're fighting with Christmas holidays and all of the deliveries. So, those companies are very stretched as to how many trucks they're getting out and that kind of thing. So, we're seeing a little bit smaller um, number of tests going to the labs each day because I think that they're just struggling with that shipping. Our case distribution still serves highest in the 50 to 65-year-old range. Um, and I think that that just seems to be the group that is out and about and doing some of those kind of things. We see cases within our schools. I know a lot of times with the media, you hear the reports that the college levels are very high. Doesn't affect us here because we don't have universities, but our schools have really held their own. We've been able to maintain them open for the most part. We did have a small shutdown at Luxembourg Casco for their primary school just before Thanksgiving, simply because we had a case that tested positive, and that particular case had hugged several members of their staff prior to going and get medical treatment, and in doing so knocked out a large number of staff, and therefore we had a closure of that building because of staff shortage.
Can I just back up 1 second on that testing? So, is that testing different from the testing that people get when they have to go for surgery?
No, same.
Same. So,
But a lot of those are rapid tests done just within a lab. So
okay.
it just depends. When we get a rapid test that tests positive, so that's an antigen test, and it is done with results anywhere from 15 to 20 minutes to within an hour. You'll get those results. So that's what our ERs use, a lot of our surgeries. Surgeries, it's dependent. Sometimes people who do elective surgery get sent in a few days before to get
Well,
tested.
Blake is going, and his surgery is on Friday morning,
Mhm.
and they're not having us come until the window is between 8:30 and 12, I think. So that's why I was asking because they said we will have they'll call us by 6 if we.
Right.
So
So
that's why I
that's
was asking why.
probably a rapid one.
Okay.
Yeah. So there's a little bit of a difference. Our rapid tests are very effective on people who are symptomatic, but for people who are asymptomatic, they do have a slightly higher positive, false positive rate. Those are primarily used in nursing homes for positive people who are showing symptoms. They're also used on college campuses quite readily because they're quite simple to use for that population. Big changes that we've seen in the last month since I spoke to you. We had new guidelines come out from the CDC on quarantine. And there's a lot of misunderstanding of those guidelines right now. So people think that the guidelines actually shortened their quarantine. It's not necessarily shortened. Our gold standard is 14 days of quarantine for anyone who has been in close contact with a positive case. That remains unchanged. What they're doing here is they are allowing people who show hardship, which could be they need to get back to work, kids who are falling behind in school, different hardships like that, an opportunity to shorten their quarantine if they agree to self monitor through the health department. So we can shorten it to a 7-day or a 10-day quarantine with self monitoring that remainder of the 14 days. And then what we do as a health department is we send them out a pre generated email every day at 7 a.m., 5 p.m. And the family has to answer the questions on symptom monitoring to make sure that they remain asymptomatic. A shortened quarantine can only be issued if someone has been completely asymptomatic through that full period.
So it's like, I have a friend who got COVID and her daughter, but her other two children and her husband had no symptoms, and he worked in a hospital, and he went to work every day. He did not quarantine.
Well, that falls under a different rule. So
Okay.
there's also an essential worker rule.
Okay.
And essential workers, our stipulations for essential worker can be followed if if it is a threat to public health, meaning that there is not enough staff to cover a shift or a clinic or a medical type of setting, or it can be issued if it is a threat to public safety, which means if it ran through and affected a large, like say the police department, we can issue contact investigations for essential workers where they would attend work remaining asymptomatic and properly PPE'd at all times, but then they still quarantine in their personal life. So the essential worker thing only works at work. And in your situation, he and the two children still need to quarantine in their personal life.
Yeah, well, he still stayed in his house. He just was away from them, and then he still reported to work.
Yep. So,
He was a surgeon.
yep, falls
So,
under essential workers for
okay.
medical. So there's a lot of different stipulations that affect different groups in a different way. It just depends on their individual situation.
I have another question. So, some people have been addressing this and asking me about this. Some haven't been asking. They've been saying, well, why is the health department having different rules for different schools in our county when we're all the same county? And I said, this is how I explained it to them. I said that you go through the guidelines with each school, and from there, they go with their, they put their own
Correct.
stuff together.
So their rules come from the Department of Public Instruction, DPI. We receive guidance through the state that we offer to help them, but in no way do we make their rules. They choose what works best for their own situation. So I can cover schools because that's on my list next. So, right now, with this new guidance that I just talked to you about coming down from the CDC, the schools have the right that they can follow the 7-day, the 10-day, or the 14-day quarantine for close contacts. It just depends on what works best for them. So, this week I will be meeting with Kewaunee, hopefully, Tuesday, to discuss their guidelines. They were thinking they were going to use the 7 or 10-day. And to do that, that's fine. They're going to have to work closely with the health department on each individual person then that is quarantined. So, for instance, you can no longer issue a quarantine to a classroom in a general setting without having the health department touch base with every single person that's in that classroom to do that 7 or 10-day because they will all have to do that self monitoring. Last week, I met with the COVID team at Luxembourg Casco. They have chosen to do a 14-day quarantine unchanged from where they've been for the entire semester, simply because it is an easier, simpler way of going about it. It's straight across the board for everybody, and they will treat all of their staff and all of their students the same way. And it just really it just helps us not have all that confusion that can come with all of the different scenarios that happen, for quarantining. So the new CDC guidance has a purpose, yet it really has kind of muddied the waters for the health department as far as moving forward.
So the Luxembourg Casco, if somebody, they can quarantine the whole class for 14 days. Is that how it?
Any school can. It's
But-
just going to be a little bit different. So they could still issue a letter that just says every child in this room 14 days from the last contact.
And that's how they're going to stay doing it.
Correct.
And how is Kewaunee doing it? Or they don't know
They
yet?
haven't decided yet. I think that's still up in the air. But if they would choose to do a 7-day or a 10-day, then you can't just issue that letter that says this classroom has been
You have
quarantined.
to call everyone individually.
If they choose to do it, if they open it up to those different guidelines, yes.
Okay.
And Algoma was still undecided as well, last that I heard. They were thinking about using the other guidance there again. They will have to go through the health department to do that. So we are working closely with our schools. We talk to them on a weekly basis. We have a meeting with the school nurses every Friday, and then I sit in on as many school meetings as I am, asked to, as far as school boards or COVID committees, trying to give them some guidance on what our information coming down from the state really means. I think that's our main job, is to do that interpretation for them so that they understand fully what it is and how to move forward.
So Cindy, if the school uses that 7 to 10 day for a whole class, then the health department has to send that email to
Every member
all
in that
those-
classroom, correct. And it also plays a factor. It gets very complicated because, it we have kids who think that they want to get back to school because they want to get back into sports. But it doesn't release you to go back and play basketball, because you're still serving that quarantine and you're still doing that self-monitoring, and they really should not be face to face on a basketball court during that 14-day period. So even though it's meant for hardships. So if you're falling behind in school, yes, we can get you back in school. You're going to have to use the proper PPE. You're going to have to maintain social distancing at all times, but it does not take away the fact that no, you're not going to be back on the wrestling mat or on the, basketball court or whatever it might be. It might be play practice, it might be whatever they're doing, that kind of thing they're not released to do. So it's just very complicated. Any other questions in regard to the school? Okay. Any other questions on COVID right now? I think the only other thing that I can really tell you is that over the last month, maybe month and a half, we have seen outbreaks in just about every one of our long-term care facilities. So we have been working incredibly closely with our long-term care facilities, trying to help them through this difficult time, help them figure out how to go about staffing and how to keep their residents as safe as they can, and how to work through the testing of a facility once you have a positive case. So we have worked very closely with them, and I think we're on the upswing. It's improving right now. So we're seeing a lot of our facilities. I actually cleared my last 2 at Algoma Long Term today for the most part. So, we're really seeing an improvement facility wide. We still have some cases out there. We're still working very closely. I think, Kim talked about parents questioning the guidelines with the schools. The other complaint that our office deals with on a regular basis is, why are we not allowing visitation at these CBRFs? And why is our rules so strict at the CBRFs? And I think it's really important that people understand, first of all, that the health department is not making the rules. Their rules are made by the Department of Quality Assurance. And then they're shared with the state of Wisconsin, Department of Health, who then gives us our guidance. So we're simply sharing the guidance, which would be best practice. Whether they choose to follow that guidance or not truly is the facility's choice. And their guidance and visitation is their choice. But we're going to give them the safest route that they can take, and they can make those decisions on their own. So right now, it's not recommended that they allow visitation. It's not really recommended that people leave the facility. And that's difficult during this time with the holidays coming up because we really don't know, you know, should grandma be going home for 3 days to visit everyone over Christmas and then coming back, and what kind of risk does that pose for the people that who are still in the facility that she's coming back to? So, there's a lot of questions out there, and I think that, you may receive some kind of comments like the health department has been very strict on that. We're truly just following the guidance that's put out by the Department of Quality Assurance, but they can certainly call the Department of Quality Assurance and ask about that guidance as well.
You're probably talking about, did you receive 2 letters also from, because they must have forwarded it to you and then they forwarded 2 letters to me.
I don't know.
I had one from a Robin and one from a Sandy.
I may have received one of those two.
Yeah,
So
and I think when I was reading them, I think my understanding is, and then I know of somebody else where it's kind of like the same thing on the kids. It's like I'm a mom with 3 little kids, not old kids, and it's very frustrating because they're struggling. They're struggling emotionally, they're struggling trying to talk to other kids or just do something. They're struggling in school. I have one daughter who is way up here and I have a son who literally fell 2 grades. 2 grades, and he's going into high school next year and I don't know what to do. I've reached out to other schools, I've reached out independently, and it's very frustrating because that's their future. And if he's 2 grades behind, how are you going to bring him up? But then I read the letters from Sandy and Robin and I get it. These are people that their moms or their dads were dying or sick and they could not touch their hand. They couldn't give them support. They couldn't be there. And I had a grandpa who was 95. I went literally every single day because my dad couldn't to be with him. And to take that away from somebody, I get it. So
it is actually available though for them to do compassionate care. So these facilities are allowing compassionate care, which means if you're in a situation where someone is not doing well, is actively dying, that kind of thing, they do allow you in. So, we need to make that clear
I think a small
that,
amount of time, right? It's
well, they're
yeah,
following it within guidelines. And if the person is COVID positive, that complicates it even more because if the patient is COVID positive and you as a family member go into the room and are within 6 feet for greater than 15 minutes, you are then a close contact and you should be issued a quarantine for 14 days. So, then that puts a difficult situation on everybody. If that person would die in the next 3 days, you can't have a funeral until your quarantine is over.
right.
So there's a lot to think about. It's not simple by any means. And so, I just think that people they look at their situation, and I understand each situation is
Mhm.
tough, but there's a bigger picture out there too. And so unfortunately, as the health department, we do need to take in that whole picture. And we're trying to do that the best way that we can and offer the guidance that we can to people to still allow them compassionate care, to allow their, kids to get the services that they need, those kind of things. So it's tough. Julie, did you have a question?
Yes, could you talk about vaccine distribution in Wisconsin?
Sure. So vaccine was shipped officially this morning out of Kalamazoo, Michigan. Um, We don't know much yet outside of the fact that the state of Wisconsin's initial batch will be 49,500 doses, and that will be distributed primarily to ICUs, um, ICU type of facilities, and then long term care facilities. So those are our top two in tier 1A. We as counties have not received any information yet as to how many doses we will receive. The only thing that I got, and that's what I was printing off right before I came down, was um, basically the fact sheet for healthcare providers as to how to give it, and then a fact sheet for people who are receiving it so they understand it a little bit more. And I haven't had a full chance to read this yet, but the Pfizer vaccine is a complicated vaccine. It is a deep freeze vaccine, which means that it has to be on dry ice or at -80, I think is what it is, at all times. So when it is not stored at that cold temperature, it depletes its shelf life. So for those of us that do not have that capability, and I don't think that there's a health department in the state that does, When we receive that vaccine and put it into our fridge, we will have 5 days to give it, and then it expires. Within that, it's also whenever we have frozen vaccines, they're a powder. So each one of those doses needs to be reconstituted. And when you reconstitute it, you have somewhere between 30 minutes and about 3 or 4 hours to give it, depending on the vaccine and how it's handled after that point. So there are a lot of handling issues with this vaccine that will have to be worked through to give it. Moderna should be going up actually in the next week or so for their emergency approval as well. Moderna is the other vaccine that is closest to getting approved. That one is not a deep freeze vaccine. It can be held in a regular freezer, and its handling is a little bit better. So, with us not having a hospital and with us not having an ICU here, I'm guessing that Kewaunee County will not get a lot of doses in this first round. I wouldn't expect us to. It's going to go to the big facilities. But as soon as I know, I can keep you posted with emails and such that would let you know some of that information.
Do you know how close the second dose has to be to the first?
With Pfizer, it is 21 days, and I believe Moderna is 28.
Oh, that's going to be a 2-shot also.
Both of them are 2 shots. Yes. So it's between 3 to 4 weeks that we have to administer 2 doses to each individual. And what the CDC, my understanding of our allotment is, so the state of Wisconsin will receive their first shipment sometime this week of that 49,500 at the CDC. Then they have flagged 49,500 doses for Wisconsin. 3 weeks from now, that will ship out again so that those same people will complete their dosage. And it won't go one dose to, more people, and then some will be waiting for their second dose. They're going to complete that vaccination before they allow more rounds.
Kathy, did you have a question?
You were talking before about the quality of assurance or something.
Yep. It's the state of Wisconsin department, and they oversee all skilled nursing facilities, community-based residential facilities, group homes, things like that. So they're the department within the state of Wisconsin that puts down guidelines for nursing home type of facilities.
What would the state do then to the long-term care? Is that
That is the Department of Quality Assurance that does all of their inspections and things like that. What they're receiving from us is they communicate with the Department of Health, and the Department of Health will give them guidance. But it's actually all of their regulations come down from the Department of Quality Assurance.
by the way, the state is here?
Correct. Yeah. And unfortunately that can mean any number of probably,
Run, right?
hundreds of different departments. It just depends on who their regulation runs through. Yeah.
Dr. So-and-so is here.
Okay,
That's all I have for COVID, unless you have more
I
questions.
do. I have one question. So with the okay, so somebody had COVID in summer and now they were next to somebody who got COVID in fall, which is like 3 months later. So they had a quarantine again. So what is the difference with getting the COVID? Because I thought if you got it, you built your immune system, we were good. Then the vaccine. Is the vaccine going to be we get it, and then 3 months later, if you're with somebody who got COVID, you have to. Is this going to be? You
Well,
know
I
what I mean? Like I thought if we got it, it was good. So you would build your immune system, you were good, and then the vaccine, if you got it, okay, we're good. But it almost feels like this is never.
Well, I think right now they've had more ability to study their vaccine on trials of hundreds of thousands of people, right? So they can tell you a little bit more about the efficacy of the vaccine. And what we know is that Pfizer's efficacy, so its effectiveness, is greater than 90%. And we know that Moderna's is coming in at about 94%. So it's highly effective against that coronavirus. I don't think they know the length of time yet as to how long it's effective because it's all too new. With corona and your natural immunity, they've only been able to study people for less than a year because truly it really didn't hit the United States until January. So we have less than a year of research behind it. And for the most part, people have not become reinfected, but there have been some instances. And I don't have the data in front of me to tell you that those people that did get a reinfection maybe had a weakened immune system, maybe had something else going on. We just don't know that right now. So I think moving forward right now, your efficacy for the vaccine will be high, and they're going to look at it year to year and see if it's either mutating with that virus or if it will stay the same. If it mutates, similar to what a flu virus does, then this could be an annual shot that some people, that could choose to get. Um, but we just don't know that yet because it's just too new. What they do know is that overall, when you have been infected with coronavirus, your immunity is very strong for a minimum of 90 days. So that's why they allow it to go 90 days. And then they're asking people to re-quarantine right now because in the cases of reinfection that they have seen, it has happened after that 90-day period. And it's under research.
So then we don't have a big light in front of us because this
Well,
could go on.
we just don't know. It's just too new. It's just too new.
So mask, I assume too, will be for quite a while yet into summer of next
I
year.
think you'll probably see it at least into summer. What I heard recently from one of the CDC experts was that they thought that maybe the United States would be sitting pretty good with vaccine coverage by June.
All right.
Linda?
Is dose 1 and dose 2, are they the same strength? Or is dose?
They're identical, but
Okay.
you have to get the same manufacturer. So if you start with the Pfizer product, you have to get your second dose of the Pfizer product. If you start with the Moderna product, you're going to have to get your second dose as the Moderna product.
So a person would be able to choose which manufacturer you want? Are you going to have both?
We don't know.
You don't know.
Right now, I would doubt it. We're just going to be happy to get something because it's just in such short supply that you're going to have to take whatever it is that's issued to your county. I
Oh,
know
heard
that
so-
the first round of Moderna, so I told you that the first round of Pfizer is coming out with 49,500 doses roughly in Wisconsin. The first round of Moderna is scheduled to be 100,000 doses. So they're doubling it for Moderna.
I heard on TV that you have to mix it. Is that right?
Right. So we get a diluent. It's a sterile diluent and it comes in a powder form. So we have to reconstitute that to give it, which is similar to our chickenpox, to our MMR vaccine, so measles, mumps, rubella. That is the same kind of thing where it's a frozen vaccine. We get a diluent that comes with it. We reconstitute it, and then it has to be given within 30 minutes.
Cindy, as a public health department, will you be administering it to the general public, or will people get it through their doctor's offices?
I
or-
think there's going to be any number of different possibilities. Anyone who wanted to be a vaccine administrator of this vaccine, this particular one, had to sign a special contract with the CDC, which is unusual for us because right now all of our vaccines come down through the Vaccine for Children program through the state of Wisconsin. When something new comes out, we're just allotted our amount. So this was specific with you had to sign an individual contract with the CDC. And in doing so, it didn't just go out to doctors' offices and public health departments, it went to pharmacies. Our long term care facilities could sign up to be their own vaccinators if they so chose. So it's a large entity of people that could choose to do it if they had, the right personnel to do so. So with our long term cares, our health departments will go in and do their staff. That's what we're contracted to do is the staff. But each long-term care facility and skilled nursing facility in the state had the ability to sign a contract with the pharmacies. And so CVS and Walgreens received that contract, and they will probably be the ones that will go in and do residents. And they're going to do these mass vaccinations of residents. And I think that was done by the state of Wisconsin to take some of the burden off of local health departments because it's going to be a shortage of staff available to get to all of the people that need this vaccine as quickly as possible. So we will be the ones here doing our general population when that comes through.
Any other questions? Then we'll move to grant update.
I just wanted to let you know we had a couple of small grants that have come through. So our WIC department will be receiving a small grant for signature pads and equipment to make them paperless. So that will come through in 2021. Deanne has written for a Department of Transportation grant, which is a smaller grant that will help us purchase car seats for people who are lower income. And we would have the ability to have a couple of car seats in our facility for when people don't have the financing to purchase one themselves, or if we're found. We do car seat inspections here. So Deanne is a certified car seat tech for our office. And when people come in, if they come in with an expired car seat, legally we can't let them leave with that. So this will allow us then to have something on site that we can replace it with. And then we also have some CARES funding adjustments that are going to be coming down this week. So maybe 2 to 3 weeks ago, we had to submit to the state how much money we had used in this first round of CARES, which will expire December 30th. And so we did our estimates of what we were going to use and spend down, and then they will be making some small adjustments. I don't foresee our funding changing at all, but I'm thinking that facilities that said that they weren't going to be using their CARES funding, it may be shifted to places that were short. So I'm hoping to get that sometime this week. Questions on any of that grant funding?
Then we'll move to the flu update, Cindy.
Yep. So we have a small amount of flu that's left in our office for adults. I think we have roughly 10 doses or so that are left. So if you know of anyone who is still looking for a flu vaccine, time is running short, but we do have it available. Cost is $30 for anyone who is not on Medicare. And then we do take some of our supplement insurance with Humana and United Healthcare. I think we have about 100 doses left for kids, roughly. So we are still advertising that through some of the schools, letting them know that it's available. We're going to be putting some more social media out over the holidays when kids might be home, a little bit more college kids coming back, because we still have some college kids that are on campus, I think. Not many, but some. So, that is available for them.
Did we do the same amount of flu shots from last year to this year?
We
Or-
did more adult. So we had about 275 doses that we ordered for adults versus 200 last year. And we've got that 10 left. So we're up a little bit on adults, and we're down a little bit in kids, partly because when we were scheduled, a lot of our kids were either in quarantine, or classrooms were missing, or a school had temporarily shut down. And we have gone back and we've done a fair amount of them. I think the one school district that we did less in this year was Algoma. We had a significant decrease in the amount of flu vaccines that we saw out of that school. And flu is starting to hit Wisconsin. So we're getting our annual flu reports in. Nothing major yet here, but they are seeing flu-like illness on top of coronavirus out there. So, the enteroviruses, the rhinoviruses, those kind of things, they're all starting to hit. So it is what it is. There's going to be a lot of stuff going on, and hopefully if we can stop at least with the flu from hitting through vaccinating, it will help our county. Questions on influenza? Okay.
Then we'll go to the November monthly report.
As far as the monthly report goes, our contracted caseload for WIC remains at 218, and we have been holding at about 200, which is pretty good. We're still one of the few WICs in the state that is actually letting people in for their appointments. Most are still doing it virtual, and we've been able to do that and do that safely, so we continue to offer that service. Immunizations, we did 115. I think that was because we completed one of the schools at that point. Communicable disease, it's slightly ridiculous, that number. So if you look at our communicable diseases, we had 2,030 reported to us, and of that, 601 were confirmed, and most of those were coronavirus. And you can see the breakdown. 16 were suspect, 29 probable, and then we had 1,384 that turned out to be not a case. We are seeing some of the other diseases come through. You know, we're seeing some of our STDs pop up. We're seeing some of our GI illnesses pop up a little bit. But for the most part, everything is still coronavirus at this point. And just to keep in mind, you know, our staff does have to follow up on every one of those cases. So it's time consuming. We put a lot of time and effort into communicable disease follow up. Um, and typically we see, you know, 189, 190 cases a year. So 2015 in 1 month is pretty extreme. Any questions on any of the activities, school visits, conferences, anything like that that you saw in the report?
We're still doing the, where we talk about health. Oh boy, now I'm drawing a blank here. I did not see it listed where, we go out and talk about food, eating good, all of that.
Sure. So the prevention program, which is the fun and fits in the
Yes,
schools,
thank you.
some of that is being offered virtually. A lot of our schools have been very hesitant to let staff in and to let the kids congregate into an area like the gymnasium or such, which is how we've done it before. So we're trying to share as much virtual information and written information that we can with the schools at this time, and hopefully we can get back out there and do more.
All right. Any more questions? Then to get back here. Agency updates.
I don't have much as far as the rest of the agency. I think I've covered a lot of it. However, I wanted to touch base on the Giving Tree. I think I mentioned last month that we were going to be doing the Giving Tree in honor of Sarah Millay again. We were fortunate to have one of our news stations come out, do some coverage on that. And as of Friday, I think we had over $1,300 that we had taken in cash donations in addition to what's under the tree. So we're doing quite well with the Giving Tree. That will be collected through the end of the month, and then we will disperse that out in equal amounts to each of our food pantries throughout the county.
Any questions? We'll move to the financial report.
All right, last on the list, you have your financial report in front of you. This is the October financial report. Our November one should be coming out in the next couple of days. But I think the big thing to point out is that we have been spending down regularly on our grants. With the next report that you receive in the future, you'll see that we should be at zero on all of the grants. Our goal is always to spend those down completely by November, with the exception of WIC, because our WIC grant we need to carry through for staffing purposes through the end of December. Our county funds, so our county immunization and our county nurse funds, will definitely not get spent down in its entirety this year. I'm thinking that we will give a minimum of 25,000, maybe 35,000 back to the county because of our fortunateness with getting the CARES funding to cover a lot of our contact tracing and needs that our staff has had through COVID. Does anyone have any funding questions?
Cindy, do you still have 4 outside people doing contact tracing?
I do. So we have our normal staff. Deanne dodged that bullet. I think she's the only staff member that didn't get trained in contact tracing. So it's myself and Rachel Bauer and Jessica Deppes and then Allie Martin from our office that do contact tracing. And in addition, we have Christy Shaw, we have Sydney Helston, who started out as a Bellin College of Nursing student with us, and she stayed. So that was nice. And then we have a college student that just joined us this last week to replace one that had decided contact tracing was not her thing. So Mariah T-Bung has come on in the last week, and she'll be helping us through the college break, basically till the beginning of February. And then we have Mary Krista Vorak as well, who's working full time with us on it. We've been very fortunate.
Any other questions? Travel request.
We
and
have none.
approval. Overtime.
Overtime, primarily we have, I don't have a report with me on it. So what we have done with our staff is one of our lead staff, so our main staff works every Saturday, and then we pair them with a contact tracer who's a contracted employee at this point. So they are not considered overtime, the contracted employees, but we have one staff member each Saturday that receives overtime, and it ranges between 3 to about 7 hours, depending on how many cases come in. Normally, it averages at about 4 hours every Saturday for one employee. And then, my time is not counted in that overtime at this point.
And that's coming with the correct,
That all
The
comes out of
funding,
the
COVID.
CARES Act is funding 100% of our overtime. So that is all additional COVID tracing. Mhm. So nothing comes out of county dollars.
any other questions? Then we'll go to the next meeting date. We're into January. Does January 11th work? Monday, January 11th. The only, I have one issue, so my son is having another surgery January 12th, and if we have to go for a COVID test, which probably will be on the 11th because it seems like it's right before, I would not be here.
Would you rather do it the week before?
We can go on the 4th if that's fine with everybody, but it is coming right off of Christmas if there's any problems with that, the 4th of January.
Whatever works.
Are you wanting to look, Kathy, quick, just to make sure?
Flexibility important.
I just, because I know it's coming off the new year, so.
Okay.
Okay, so let's do 8 o'clock on January 4th.
Oh, 8:30?
I mean, sorry, 8:30. I'm thinking school. Sorry.
That's okay, Kim.
Okay, so health, 8:30 on the 4th.
Can Cindy get all your information
Yep.
ready a week earlier?
Yep,
Okay,
you
thank
bet. We will.
Okay.
Okay. Then at this moment, is there anything anybody has to discuss? So then if I could have a motion to adjourn?
Make a motion to adjourn.
I second
I
it.
don't know who said that.
Julie said it, Kathy
Okay,
seconds.
Julie said it. Kathy second. Thank you.